the Consultech Technology Cafe. Today we're going to be discussing HIPAA IT. Really talking about what the challenges are that the HIPAA security rule presents, especially as it relates to the small healthcare practice. I want to draw your attention to the center of the page you're looking at right now. If you click on that link, it will take you directly to the download for a 12-page white paper that talks about the HIPAA security rule in detail. Also talks about the EHR, the electronic health record that's been in the news lately, and some of the challenges that that presents to the small practice provider as well. When one looks at HIPAA and the timeline for HIPAA, it really takes you all the way back to 1996. That's when Congress first enacted the Health Insurance Portability and Accountability Act, which is what is commonly referred to as HIPAA. Now things got a little more interesting in 2003. By then, HIPAA had been transferred to the Health and Human Services Department of the government, and in 2003 they developed what they called the HIPAA security rule, which laid out in very great detail exactly what healthcare providers of all sizes needed to do to secure electronic health records, physical health records, essentially any personal private information of a patient. Most recently, the Obama administration has really been focusing on IT as a way to improve our healthcare system, and in another light has also recognized that cybercrime is a growing phenomenon, has no end in sight, and to that end Mr. Obama has gone on record as saying he will be appointing a cyber czar. So worth noting that this is not going away. If anything, security regulation is bound to get tighter as we move forward. The reality is, therefore, that as a small practice healthcare provider, you can expect to see significant regulatory changes. And most likely those changes are going to be more stringent and require more technology, more procedures to ensure that privacy is kept. The security rule in a nutshell: designed to ensure the confidentiality, integrity, and availability of electronic protected healthcare information, EPHI. There's really three areas of the HIPAA security rule. They call these the control areas. The first is technical safeguards. Technical safeguards establish how to protect data, control access to information, and make sure that unauthorized access does not occur. So dealing a lot with the IT end of the world. Then you also have your physical safeguards. This talks about the environment within the healthcare practice, looking at risks such as fire, weather, the environment, or physical intrusion. People walking into an office and walking out with healthcare records. Third is the administrative safeguards, making sure that we document informal policies and practices, our data protection, making sure we have a security management process in place, and implementing various specifications. Now, for the purpose of this slideshow, we're really going to focus on the technical safeguards, and they can be broken down into 5 specific areas. Those being access control, audit control, integrity standard, person or entity authentication standard, and transmission security standard. Let's take a look at each of these in detail now. The access control standard says that we need to implement technical policies and procedures for electronic information systems that maintain electronic protected health information to allow access only to those persons or software programs that have been granted access rights. So what's that mean for you? That means that from an IT perspective, you need to have the security infrastructure in place to ensure that you can truly protect your patient's records. The audit control standard. Making sure that we have a mechanism in place that allows us to record and examine activity in your information systems that contain or use electronic protected health information. Third, the integrity standard. The integrity standard deals with protecting electronic health information from improper alteration or destruction. So this deals with the fact that these records are important and should have a level of permanency, and that they cannot be compromised or should not be compromised by those people who are not allowed or should not be allowed to alter them, and also deals with the safeguard from destruction. The person or entity authentication standard really speaks to making sure that someone who is trying to access the information is who they say they are, or if they're an entity, that they are who they truly say. So this really gets into what would be called endpoint verification. In the transmission security standard, now we are looking towards, as you transmit information between locations or even within an office, are you taking the appropriate measures to make sure that unauthorized access is being prevented? So are your network communications secure? Now that's just a very brief overview. The 2003 HIPAA security standard is a very complicated piece of legislation that puts a tremendous burden, both financial and from an expertise perspective, on the small healthcare practice provider. So what can you do next? I highly recommend that you download our 12-page white paper that deals with not only the HIPAA security rule, but also begins the discussion of where the electronic health record is taking us in terms of security, and deals also with the concepts of business continuity and practice continuity, and how those are intertwined with HIPAA security and EHR. Appreciate you spending time with us today at the Technology Cafe. Download the white paper and look forward to speaking to you during our next conversation.